Good evening, all of you. I'm really happy to meet you all today for this orientation program. Good evening. So, orientation session is going to be really very useful for all the PGs who have just joined your PG as MD Biochemistry, right? So this session, so if you had just joined your MD, so this is a session for you where you can understand about what you're going to go through in the next 3 years. Yes, and what you can do beyond. Yes, so that is what is the main focus of this session is going to be. So I will be sharing all that I know. Yes, all that I know, so that you can take it to yourself, and whatever you want to follow, you can, and whatever you know beyond that, you can. Yes, so there is so much that you have to know about MD biochemistry, which on day one, which we wouldn't have known. Yes, so the UG biochemistry that we had learned and this MD biochemistry that we are going to in the next 3 years is going to be completely different. Okay, so that is the point that I want you all to have in mind. Yes, so I would like all of you to just switch off your video and also mute yourself, okay? Because the session is being recorded. Fine. So this here, so I'll be sharing all that I know. Yes, so all that I know, and I will be sharing my perspective. Yes, so if you want to share your perspective, you're very welcome. You can put it in the chat box, and if you have any doubts, you can just put it in the chat box, or even otherwise, you can connect with me through Telegram or Instagram. Yes, or even download the app that I have, which is the clinical biochemistry app, which I will be showing you in the further slides. In there, via that platform also, you can connect with me, right? So basically, I to introduce myself, I am Dr. Nivedha. Yes, I'm Dr. Nivedha, and I have done my MD in biochemistry. And to just tell you about my, area of interest and area of research that I had done, my thesis topic was on cardiac biomarkers. Okay, so and specifically, it was about the heart type fatty acid binding protein, which now there are so many studies have come about, in the recent years. So I was interested in studying this biomarker in, as an early marker in MI, as well as how it is affecting the all other cardiovascular diseases like your MI, arrhythmias, heart failure, and I compared it with the other known biomarkers in market. So this is my thesis topic, and I also had some few studies that I had done on metabolic syndrome, as well as thyroid disorders. And since I did my PG during the COVID period, so I did a study on COVID-19 and DM, for which even I got best presentation award also, and dyslipidemia. So dyslipidemia and fatty liver and thyroid disorders. So with some correlations and comparisons with few markers. So these are some of it's a general view that I just gave you. These are areas where I touched for doing my studies. And recently I am working on a study on biomarkers for preeclampsia. Okay, urine biomarkers for preeclampsia, and I'm a co-principal investigator, where I'm doing it as a current study. Yes, so this is just about my work in my PG, and the roles that I play and the roles that I have in my hand right now are: the first one is co-founder of the startup company in POCT Diagnostics. POCT is nothing but your point of care testing diagnostics, and the name of it is goes by Spot Bio Innovations Private Limited. Okay, so this is my startup. So I'm doing this biomarkers and preeclampsia study. Okay. And as you all know me, or most of you know me, as the educator in clinical biochemistry app. Yes. And also I am a consultant biochemist in a private lab. So as soon as I finished my post graduation, I did a SRship. After which after which my roles are these. Okay, so this is just an introduction about what I am doing and what I did. Right. So this is so moving on to the where to connect. So where to connect with me in Telegram, WhatsApp group, Instagram. Yes, and also in clinical biochemistry app. There is a chat box where you can post your queries and you will be answered by me. Okay. So here again, this is the Instagram profile, and also this is a Telegram link. Okay. So this is where you can connect with me. And these are the available courses in the clinical biochemistry app. So I'll share the link with you. So in the description box also the link will be shared. So you can just have a look at it. Many of you would have downloaded the app, I guess. So there is a course, complete course for MD biochemistry with different year validity. So like 6 months, 3 months, 1 year, 2 year, 3 year. Yes, you have different validities where, I'll be focusing mainly on different contents. The contents will be mainly focused on your syllabus. Yes, so it will be useful for your exam preparation as well as practical exam preparation and doubt clearing sessions. Everything will be available through this course. And right now, I've just started with Study Teach textbook of laboratory medicine with me. Okay, so I've just started this. So it has been put as a separate course, but for all those subscribers, it is freely available. You need not buy it again. And there is one more course which is called the Biochemistry Library, where I have just compiled or where I have just uploaded all the books that I have with me as PDF. Yes, so you can very well refer, and you will know about different types of books that you will be using for your PG level learning. So in the further slides, we will also see that. Okay. So these are and even for MBBS Prof 1 biochemistry courses available. And this course is available in, Android, iPad, iOS, and mobile phones. In iPhones, you can view the contents. Okay. Lectures and notes, you can view them. So this is how it is about the clinical biochemistry app where I am the mentor and educator there, right? So let's move about. Okay, let's move on to today's focus. Today's focus is basically the first and foremost thing I want you to do is accept. Okay, so you have joined this course, MD Biochemistry. You have to accept it. So why I stress this is that basically it can be difficult. Let's face the reality. It can be difficult for you to convince your surroundings, especially non-medicos, to about choosing this course, is it not? So this is a reality, but you have to come about it. You have to overcome it. Yes, how do you overcome it? The first thing is you must know the importance of this branch. So at the end of the session, you will have the confidence on telling that this is a clinical branch. Yes, so you will have the confidence. So it's how we portray ourselves, it's how we update ourselves, it's how we convey our branch is what matters more, and that's how people would perceive us, right? So the first point that I want all of you to have in your mind for the rest of your life is accept the branch. Okay, so accept the branch, it's and go about it. So how you can go about it is what I'm going to explain in the further slides. Okay, so basically you have to enhance your skills in diagnostics and management. Right. So from day one, when we had entered into an MBBS college, we are all doctors, right? So we are doctors. So we are dealing with treating and managing patients. So the concept of MD biochemistry is to enhance our skills in the diagnostics as well as in the management of patients. So we are in the patient care. Yes, the area where we focus on being a clinical biochemist is what varies. So always think yourself and start portraying yourself as a clinical biochemist, as a diagnostician. Right. So this is what is the first point, and the first point that I want you to have it in your mind. Okay. So at the end of the session, you will definitely have that confidence. But in the first slide itself, I want to put up that you have to accept it. You have to update yourself. You have to start, you have to start practicing being a clinical biochemist. You have to start practicing as a diagnostician. So that is your role. Not your role, it's our role. Okay. So I know you're all my colleagues and my friends. So it is our role to be a diagnostician, to start talking like and behaving like, thinking like a diagnostician, and that is what we all are. Yes, and this will automatically change the perspective of the person who is seeing us, right? So you need not convince anybody. Okay, you need not convince anybody. The way you are will reflect who you are. Yes, so that's how. So that's the first thing that I want to stress. So next let's dive into what our 3-year journey. So MD biochemistry is going to be a 3-year journey, right? So you have to know, you shouldn't have any doubts about how the next 3 years is going to be. Of course, you will have so much of nervousness. I have seen PGs, after choosing the branch on the day one of the branch, they'll be very anxious about what they are going to go through in the next 3 years and what they're going to do after the 3 years. Yes, so they will have they will have that anxiety in them. So much of cloud of thoughts, traffic of thoughts come about. But what I would advise is just pause. Okay, don't react to any of your thoughts. Okay, don't react to any of your thoughts. Just pause. Let all your thoughts come away. Right? Let all your thoughts come. So whether you want to go about NEET SS or INISS or you want to do FRC path. So I've seen students who will just enroll, on day one of joining MD biochemistry to do the FRC path or to do NEET SS. So they will just enroll themselves in any course that is teaching NEET SS. So I don't want you to do that. Just wait for some time. Yes, on day one you don't do that. Just wait for some time. Let all your thoughts settle, and that will give you an idea. Yes, because why I'm telling you this is that I myself don't know. I myself had no idea that I would be an educator in an app, or I would be a founder of a startup company. I did not even think about it. I did not even imagine it. Nobody even told me about these two roles. Okay, all I knew was that I could pursue a research role, or I could pursue, in academics in medical college, or I could be a consultant biochemist. So that's what I've been taught in my PG period. I did not even know that I will be, educated in an online-based platform, that too for PGs. No, I literally did not think about it. Okay, because on day on in my PG itself, I was very nervous. Yes, during the first year of my PG, I was very nervous. But as a senior, as a senior in this field, I would advise that you need not be nervous. Okay, it is okay to be nervous. That's the thing you should understand. It's okay to be nervous. Just pause and let all your thoughts come, and after that you will get an idea. Right. So on day one, you need not decide anything on what you're going to do in the next after 3 years. Okay. So utilize these 3 years. These 3 years are just for you. Utilize these 3 years. It will not come another time. Yes, it will not come again. These 3 years will not come again. Only in these 3 years, you can open your book and study. Only in these 3 years, you can develop your skills. Only in these 3 years, you can attend workshops and hands-on trainings. Okay. After that, we will not open our teach textbook and read, is it not? So that's how we are. So in these 3 years, whatever maximum you can do, just do it. Okay. And I'm going to tell you what all you can do so that you can focus on those. Rather than sitting and thinking what I can do, I am just putting it straight to you. I will even share the slides. So putting it straight to you, what all you can do, what are all the different options that you can do in the next 3 years, so that you don't have to think. You don't have to think even. You can just do it one by one, right? So here we are going to focus on a year wise approach. So what you can do in the first year, second year, and third year, right? So what all maximum I could tell you, I will be telling you, even if it is a long session. Okay, will not take more than 1 hour, don't worry. So I will tell you whatever maximum I know. There are things that you can do beyond this also. Yes, that's, you have to tell me that. Okay. So let's, yeah. So let's just overcome our nervousness here only, right? So you need, so let all your thoughts come. Just pause, don't react. Just let your thoughts settle, and then you will get a idea, right? So this is what it is. So starting with the objectives of the MD residency program. So according to NMC guidelines, so I have put details about, details according to the NMC guidelines also. Okay, so basically the app that I run is actually according to the NMC syllabus, right? So anybody across India, all the universities across India pursuing MD biochemistry will be benefited out of it. It is not restricted to any particular area. Yes, any particular university, because all throughout India, all the universities follow the NMC syllabus for MD residency program. So you need not worry. So this, everybody is going to be benefited out of this app, right? So first thing is objectives of MD residency. According to NMC, they say the objectives of MD residency is, first is acquisition of knowledge, acquisition of skills, teaching, training, diagnostic lab skills, professionalism, ethics, communication skills, and research. Okay, so these are the objectives of MD residency program. So in your 3 years, this is what you need to be focusing on. So update yourself with theory knowledge, with practical knowledge, with skills, training, teaching. Yes, teaching is an integral part of any doctor. For us, teaching is actually very, very important. So start teaching to your colleagues or to your juniors, to MBBS students. So that's how you will enhance your teaching skills. And also lab skills in your lab postings. Just do whatever maximum skill that you can attain, or if not, attend workshops, hands-on trainings, which are, they have been conducted throughout, throughout the year in so many places. So it's just that you have to search for it. Yes. So the communication skills, research activities are again an integral part of MD program. Yes. So these are going to be the objectives. So according to the syllabus, NMC syllabus, we have 4 papers. Okay, just to orient yourself, being a fresher, we have 4 papers. Each paper concentrates on different syllabus. Yes. So in the first paper, it concentrates on the chemistry of your carbohydrates, proteins, fats, and also lipids, amino acids, and also your acid-base balance, fluid electrolyte balance, instrumentation, and lab medicine. Lab medicine is a very important part of this paper one, where you have, the instrumentation part, biostatistics, research methodology. They've newly added basics of medical education in teaching and assessment of biochemistry. So all these come under paper one. And the second paper will be involving all the UG topics. Yes. So we would have learned about different metabolism here, where all the cycles come. Yes. So metabolism, nutrition, and everything, electron transport chain, bioenergetics, detoxification, xenobiotics, free radicals, antioxidants. So all these come under paper 2. They are literally also enzymology. So they are literally our UG topics. Yes. And paper 3 will concentrate on genetics, so molecular biology, and as well as cancer, immunology, and environmental biochemistry. Paper 4 is basically endocrinology with recent advances, also clinical chemistry, okay, on all interpretations, clinical interpretations, and, biochemistry of different organs like your kidney, liver, lens, heart. So all these come under paper 4. Basically, clinical biochemistry is paper 4, recent advances with endocrinology, right? So this is how the syllabus is divided into 4 papers. So you will be writing theory 4 papers, right? So this is about your syllabus. So let's get into year-wise approach. So what you should be doing in year 1, year 2, year 3, I will just give you an overview, right? Okay. So in the first year, what you will do? The first year, I want you to concentrate on all the UG topics. If you take a PG textbook and start learning, it will be difficult. Okay, so don't worry. It will be difficult to comprehend these topics when you start learning from Harper or Leninger. Yes. So what I would suggest is you revise these UG topics from the basic books like your Vasudevan's textbook or Rafi's textbook. Yes. Vasudevan is getting updated year by year. So you will have some recent updates even. And Rafi's textbook. So Rafi's textbook is actually easy to understand and it's an easy go book. So you will revise the topics from these basic books. And then what you should not limit yourself with just this. Yes, because we are a PG, we are pursuing PG, we must have a PG level understanding of all the UG topics. Clear? So how do you gain that? You gain that by referring textbooks like your Harper and Leninger. Yes, so Harper and Leninger are actually gives us, a detailed, in-depth learning on each topic. Yes, this actual core biochemistry comes from Harper and Leninger. So PG level understanding of all the UG topics, you have to refer these two textbooks in your starting from your first year. Yes, so that's how you will get used to these textbooks. And so in your college itself, they would recommend or they would tell you that you have to attend research methodology workshop. Nowadays it's been made online. Offline trainings were there during my period. There are online training programs, work training or workshops available. You have to, and actually within the first year period, you will have to pursue this workshop. Next is you have this BCBR course, from NPTEL website. NPTEL website, you need to take up this course, which is actually basic course in biomedical research. And in the recent NMC guidelines, they have also included good laboratory practice course, ethics course, as well as BCLS, ACLS, basic cardiac life support, advanced cardiac life support, the like training programs which can be conducted by your own institute. Yes. So this has been made mandatory in the first year itself. Yes. So this is according to your NMC guidelines. And logbook you have to maintain starting from day one. So what is basically logbook is something that will have all your day-to-day activities. Yes, so what you do on a daily basis, what are the seminars that you attend, what is the learning point, or what is the skill that you had developed that day, you have learned that day. So these things you will be entering all your seminars, conferences, workshops, training programs, all these are your micro teaching, journal clubs that you have done, PG seminars that you have presented, all the papers that you have done, oral presentation, poster presentation. So everything comes under this logbook. So all these have to be entered in this logbook, right? Next is the use of computers. Understanding and learning to use computers has become mandatory nowadays because we are living in an age of artificial intelligence, is it not? So use of computers is very, very important, and they have stressed this point in this recent guidelines that I saw. So you have to start developing your computer skills even, right? So these are few things that you want to note. Yes. So in the first year of PG residency, I let me tell you what all books that I bought in the first year. In my first year, I bought Teach's textbook. Yes, I bought Harper's. I bought Lippincott's. I bought even Bishop's textbook, which will be shorter version of Teach or the same topics, but it'll be very short and crisp. Yes, so Bishop's textbook I had got. These are the books that I bought during my first year. And during my third year, second year, third year, I even got, copies of Kaplan, Leninger, Crookes, Marshall. Yes, Wilson and Walker, recent textbook, I bought it. Yes. So these things, I have these. So it is kind of, learning from PDF is difficult. So I thought I would make a copy of all these. So I have these books with me, right? So maybe I would also advise you to buy these textbooks. Also, some books are good to have. So make copies of these textbooks, right? So books to be bought is definitely Teach's textbook of lab medicine. This is the recent edition, which the name of which is Teach's textbook of lab medicine. So the PDF is available. I have shared it. It is available in the e-library, even in the course. Yes, in the app. So you can look at it. So if you want it, you can just text me. I will send you the PDF. Lippincotts, Harper's, you have to buy it. Okay. And good to have is Kaplan. Kaplan is some of the topics will be easy to understand in Kaplan rather than reading from teeth. The instrumentation part or, clinical chemistry part will be easy to understand when you read it from Kaplan. So that's where Kaplan stands out. And Wilson and Walker for some instrumentation topics, it's actually for even, it's kind of useful. The recent book is very, very good. You can buy it. It's around 2000 or something. You can buy it. And Leniger, as I said, it covers core chemistry of each of the biochemical pathways and molecular biology. Okay, and Crook's textbook is very, very good. Okay, it has so much of flow charts in it, so it is very good actually for endocrinology part and clinical chemistry, acid base, fluid electrolyte balance. This part is very, very good. So in Crook's textbook, so which you can just go through the flow charts and tables, and this is very, very useful. Marshall is it's good in metabolic medicine. Okay, Marshall is very good in metabolic medicine. They even say they cleared the FRC path, the first part, by just reading Marshall, as well as INI SS. When you write INI SS super specialty, you can take up metabolic medicine course from AIMS Rishikesh, right? So for that, even you have to be concentrating or reading topic from Marshall's textbook. So that important is that book. So it is actually very good to learn also. So if only during your PG period we will have time to read this. Okay, so just take these books from your library, college library, or you just download the app. You will have it in the e-library. Just learn it, just read it. Okay, and the basic books like Vasudevan, Rafi, and Bishop is again a good book. Okay, it will be like teens only. The contents of it will be like teens, but it's a nice book, shortened version. Okay, so these books are good to have, right? So where can you use all these books? So these are the book list that is being given in the NMC syllabus. Okay, so you have Leninger, you have Stryer. Stryer is again even deeper than Leninger. It has only chemistry. Okay, so those, if you are very much interested in chemistry of all the pathways, you can read from Stryer. Wyatt and Wyatt is bit again, it's chemistry only, but it will have so much of pictures and it will be easy to read. And Devlin, it's a big book with small letters. Okay, so Devlin is basically, again, there will be so much of extra points about clinical points which will be in between. So in that way, Devlin will be useful. And for immunology, the standard book is going to be QB Immunology. Okay, all these books are available. Again, I'm telling you, all these books are available in the app, right? You can download. And the QB is immunology. If you want to know in depth on immunology, otherwise I would recommend Lippincot's immunology will be more than enough for basic immunology understanding. Next, what you have is okay. Next, what is this? This is Wilson and Walker. Yes, this is Wilson and Walker that we had seen already. Again, you have this Bishop's book. Yes, Teed's book, and Harper's, Lippincotts, Harrison's. Harrison's is for Harrison. Harrison is plays a very important role in our life. Okay, because if anything that you learn, it's all clinical. Okay, we will be learning clinical stuffs only throughout. Those things. What is the diagnosis? What is the medicine part of it? Core medicine part of it. You will have to read Harrison's. Right, so that's very you have to read the Harrison's. That's what I would recommend. Which means that, for example, when we learn about endocrinology, so in our textbook we would be learning about all the diagnosis part we will be learning. Okay, if you take Harrison's, the same thing. If you start reading from Harrison's, starting from what the disease is, what is the clinical feature, how is this diagnosis made, how is the treatment made, whatever you read from Teats, it'll be shorter version of it given in the Harrison's, so it'll be easy to correlate. Yes, and also you would get extra points on the management. So this is what is about Harrison all about. I will also tell you where you must refer all these textbooks. Okay, how will you read all these textbooks? Now it's a don't be scared. Okay, so you must know that these are the books that we have to follow. So Davidson's principles. If you had in your MBBS, if you had learned Davidson's, you can go about it. And this one, you see, the Marshall. That's what I said. This is the Marshall textbook. For metabolic medicine, it's very important. And you have a case oriented approach. You have a book like Rex Montgomery book. And this is another good book. Okay. This is Vala's interpretation of diagnostic tests. It will take much time to read from this, but if you are going to discuss with your friends, colleagues, juniors, and read, this is doable. Yes. So these are books. These are some of the books, or these are the books that have been given in your NMC guidelines. Okay. In addition to it, you also have a book called Godker. Okay, Godker and Henry's. Right? Are you all able to hear me? Yes, right? Are you all available? Is my internet stuck? No, right? Yeah. Okay. I could not see any doubts in the chat box. Okay, how should I take it? That you are very deeply listening to the session, or you don't have, or you're not at all listening? It's not like that, right? Yeah. Thank you. Thank you, doctor. Right. So you have these textbooks in your NMC, deeply listening. That's great. So you all have you have these PG, these are all PG textbooks. So in addition to it, you also have a textbook called Henry's Lab Medicine, and also you have Godker's textbook. Okay. So these two textbooks again emphasizes on lab medicine only. Godker, even you will have those parts that are not available in the teams, like your auto analyzer, semi auto analyzer. These practical aspects and all will be available in Godkar's textbook, which you can read it if it's available in your college library, or even it's available here. Where is it available? As I said, all the books that I mentioned are available in the or available in the course. Yes, it's biochemistry library, right? So when do you use all these books? Basically we can't keep reading all these books from top to bottom, right? From page one to page last. So where can you use it? So whenever you're exposed to seminars or micro teaching, whenever you ask to prepare for any test, short test, I want you to take up these books, open these books, read from all these books. Because in those times, you will be concentrating or focusing on one single topic, right? So read that one single topic from all these books. Nowadays, we have AI, we have Chat GPT. Okay, but please don't go for it. Go for the textbooks first, and then you can go, if you want to make an outline of your seminar, you can go for Chat GPT. But if you want to understand each and every line and make up or elaborate, you have to go for books. Okay, traditional learning from books. So these, and you also should know about all the it should I mean you also should know about all your each of the book, what content does it have. Yes, that also you should be knowing. If you should be knowing that for any tests or seminar, please open up all these books, read one topic from multiple books. Okay, you will love it, right? So you will be engaged all the 3 years, so you can take up this idea, right? So whenever you ask to read any topic, from in your department, your professors would ask you to learn some topic and come, right? So just by so just you don't do that from your Chat GPT. Do it from your textbooks. So read that topic from all the textbooks. So you will have a better understanding and different view of that particular topic. Okay, so this is what I would advise you. Right. So next thing is this is what I had told. Okay, referring these textbooks are must. Right, referring these textbooks are must. So you will be exposed to in your PG the academic activities. You will be asked to present a PG seminar, micro teaching, journal club, 8com, integrated seminars as well as attend conferences, right? And the points are also important, is it not? So what is it basically? Micro teaching is nothing but seminar is like a PG level seminar. You must do it for 1 hour. I've done it for 1.5 hours also maximum, or the same topic, the one topic 2 days also I have taken. So this like it's kind of shows your interest. So where you have to form a flow of ideas, they have to integrate one by one after the other, so that whoever is listening should understand you. Whatever you write in your slide, you will definitely understand. But whoever is listening, if they want to understand in what flow you should write, so that's how you should think whenever you prepare a PowerPoint for your seminar. Yes, that's one good advice that I would give you. Next is micro teaching is like, how you teach your undergraduates, right? So because we will be employed in a medical college, you should our work is to teach our MBBS students. So how do you present your thoughts? How do you present the topic to a MBBS student? So that is what will be evaluated in a micro teaching series. Journal club, the student, I just took this from the NMC guidelines. Okay. So here, what journal club is nothing but you must evaluate an original research article. And basically, it should be outside your area of work so that you can learn new techniques. Okay. And what will they be evaluating you for? What you should, how good you understand the research question, and how good you I mean, you will again be evaluated for how you understand the study design methodology and the statistical tools that are being used in the study. Yes, so this is what you will be evaluated for. So whenever you pick up a journal, good journal, standard journal, you pick up a journal, and you have to do this critical appraisal. Yes, so that is what will be evaluated from you in a journal club session. Then EdCom series, integrated seminars with different, horizontal and vertical teaching is all there now. So these things you will, I guess, So all these things to which you will be exposed in your PG, right? So again, another important thing that you will be doing is what? Thesis topic selection. So you must select your topic. You must attend this research methodology workshop where you will be again trained to select a topic, how to select a research question, how to select a research topic. So after you do this, you must get a ethics committee approval, institutional ethics committee approval. So this will be your work in your first year, mandatory work in first year. So in second year, you will be continuing with continuing with your study. Yes, thesis study. You will be collecting samples. You will start analyzing them. Yes, and before final year or in the half of your final, you should be finishing off your write up also. Yes, so that's what will be the plan according to thesis. And getting a MB membership is again is mandatory and will be useful also, right? So all your oral presentation, paper presentation, poster presentation, you can do it in this AMBI, which is again a national conference, right? So you can do it in AMBI, which will be even more valid and useful to you. So this is what you will be doing in your first year. About theory, I have told you. What are the books that you need to refer? I had told you. Now, yeah, AMBI membership is mandatory, which means it is useful. Yes. Okay. So we are all AMBI is nothing but Association of Medical Biochemists of India. So we are all medical biochemists, right? So we need to be a member of it. Please tell about your startup. Okay, I will tell. How is SK Gupta for immunology? Yes, it is good. But the standard book for immunology is going to be QB's immunology. Okay. So coming to academic practical skills. So academic practical skills, which I mean, you have to know how you should do your UG practicals. Okay, and these are all undergraduate level practicals where you must be aware of all these. You must be able to perform these tests. Also, you must be able to perform the reagents for all these. Yes, so you must know the concept, you must know the procedure of all that. Yes. So during your first year, this is all that you can try. So the reactions of carbohydrates, amino acids, proteins, and lipids, also demonstrating the constituents of milk. So for UG, practical manual will have all these. Okay. So start doing it. Start doing it in your laboratory, which will be interesting, right? And how to demonstrate normal and abnormal constituents of urine. So much of clinical points you will get to know if you start doing these kind of small practicals. Okay, UG level practicals. So only these three has been given in the recent one, but in the older MCA guidelines, the other things have been given. Okay, so let's just see what they are. Determination of iodine number, saponification number of fats, the estimation of ammonia and amino acids by titration. If your lab has the facilities for these, you can go about it. Also, estimation of nitrogen estimation in a given amino acid solution by microgeldal method. And phosphorus estimation, ascorbic acid in lime. See how these are interesting, right? You have these many options that you can do in your lab. Yes, so you should know this. Estimation of proteins by Follen's method and dye binding method. Then 2D paper chromatography. This we have in practicals, right? Also preparation estimation of starch, glycogen, cholesterol, casein, hemoglobin from the samples, and also enzyme activity determination. So you have these things. Yes. So this is all about your UG level practicals that you must be trying in your laboratory. In clinical laboratory, what you can do? In clinical laboratory, I would tell you again in the second year how you will be focusing on your lab postings. Okay, what all you will be focusing on in your lab postings. So there comes LG chart plotting and interpretation of them by Westcott rules, I will tell you. And also, optional is determination of reference values for any one parameter for clinical laboratory. So this is actually, as you can see, it's Medical Council of India, MCI guidelines, but still, you must know that there are several options, several things that you can do in your laboratory. So that's what I want you to understand. Also, you will have these, if you know about the demonstration of these techniques, which has been given here, separation of peripheral blood lymphocytes, and subcellular fractionation, marker enzymes, ultracentrifugation, isolation of DNA, RNA, plasmids, agarose gel electrophoresis, that we will be doing. Basic techniques in cell culture, HPLC, if you have to be at least a demonstration of it, if you know it will be good enough, it seems. So that's how they are. That's how the guidelines are, right? Again, in your first year itself, you would be posted in your laboratory. Yes, in some places, from 6 months period itself, they'll be posted in the laboratory, or even from the second month itself, they'll be posted in their institution laboratory. So wherein what you should do is first you must understand the lab routine. So what is your lab routine? That's what you have to understand. Next thing is what are all the analytes that your lab performs? You must be knowing that. And what are the methods of estimation of those analytes in your laboratory? You must be knowing, right? Third thing is you must know what are the instruments and the equipments that are available in your laboratory and what is the principle on which it works on, right? So that you have to understand. And the most important thing is going to be the understanding the quality control and calibration. Okay, QC and calibration stuffs you must be knowing. So where your LJ chart plotting, LJ chart and interpretation using Westgard rules come into play. So if you do it on a day-to-day basis, it will be very useful to you. Next is the very important job as clinical biochemist is going to be clinical interpretation and correlation. Yes, that is going to be our major role. Yes, as a clinical biochemist, this is the important role that we play. So laboratory medicine and diagnostics is what we specialize in. So we must keep learning day to day. So we must keep learning. We must give our ideas. So all the interpretation comes in our field, in our branch. Yes. So this is all about your first year of residency. So what you should learn, what are the books that you have to refer, all that I have mentioned to you, right? So if you have any doubts about first year of residency, Yeah, about the calibration factor. Yes, all these I have to be, I had explained, these all will come under theory classes. Okay, this is an orientation session where I will give you a gist on what you should know and do in your PG period. Okay, e-journal and paper poster presentation is again, it's nothing but a study, right? So you are basically picking a research topic. You are collecting the samples, analyzing these samples based on what study you are doing, and you are making a manuscript. Yes, and this manuscript you are either publishing it or you are doing it an oral presentation in any conference or poster presentation in any conference. So this is what is about your paper and poster presentation. So basic, so this is this just you will prepare an abstract and a manuscript. So this is what you will be doing here. Thesis is kind of, it's very much elaborate, right? So you have so much of things that you need to work on when it comes to thesis and dissertation. Okay. So next is we will move on to the next year. Yes, so we have completed our first year of residency. Okay, with we have the basic knowledge of our laboratory, we have the basic knowledge of on all the theory knowledge on our UG topics. Yes, also we have theory, skills or the practical skills on academic practical UG academic practicals. Right. So these things are we are aware of, and we also know what are the different PG level textbooks that are available to us. Yes. So during our seminars, we will be using or we will be referring all the textbooks, right? So that is what we had learned so far. This is about the first year of residency. It may change, okay? So one more thing that I want to share is some in AIMS it goes by semester wise, right? So that's kind of different. In universities, according to NMC, it's going to be first year, second year, third year, and from third year you will be writing the exam. Yes. So in some colleges, depending on their own rules, there are certain modifications that happen, but throughout what all the things that I'm going to tell you today is what you have to be doing as a MD biochemist. Okay, that is what I will be sharing to you. Yes, so this point just remember and apply it wherever necessary. Okay. So second year of residency, you must be thorough in and you must know in and out of your lab medicine. So that is what we are going to be dealing with in the second. So first year we had started off. Second year we are going to be a specialist in it. Okay. So in second year, what we will be doing is that we need to know the lab routine. So in your lab, whenever you step into the lab, the first thing is you must know what is the pre-analytical phase, what are all the stuffs going on in the pre-analytical phase, what's the analytical phase, what are all the things that you need to focus in the analytical phase and post-analytical phase, and what possible errors that can occur in these three phases you must know and you must sort out. Okay, so you must understand those. So that becomes very, very important whenever you enter a lab. So the PG is as PGs, we need to be posted in each of these phases. Like even in sample collection, you need to be posted in analysis post and analysis phase, you need to be posted, and also in the report section, result entry section, you need to be posted. So in each and every phase of the lab, we need to be posted. Okay, that's when we can understand about starting from the order entry till the result dispatch. So we need to understand all the things in and out about what is happening from start to end. Only then we will be able to troubleshoot where the error is, if at all it occurs. Right. Next is sample collection is very, very important. Quality control, so maintaining internal quality control as well as EQA's external quality assurance scheme. And then how do you do that? You need to plot your Levy-Jennings chart and you need to interpret it with the help of Westgard rules, right? So you must know about accuracy, precision, how you calculate it. So all these, don't be scared of these terms that I'm telling you if you're a fresher. You will be knowing it as day goes on, right? Then after this, these three things are very, very important. Okay. So all these, where do you learn? Even if you're a single PG in your department, there is no one to help you. From where can you learn? Of course, you can learn it from the app, but otherwise, personally, you can learn it from Teats and Kaplan, right? So make it a point that in your lab posting, you have these books with you, Teats or Kaplan. On some topics, if you don't understand in Teats, you can refer Kaplan. So make it a point that you have this textbook with you in your postings. Okay. So as and when you have a doubt, or as and when you see things, you read things from this textbooks. That is going to help you a lot, right? So sample collection, QC, and all your phases, pre-analytical, analytical, post-analytical phase, all these things have been elaboratively given in your Teats and Kepler, which will be very interesting as well as important, right? Next is LIS, so Lab Information System, about knowing about it, and automation, knowing about automation. So that also becomes important in the recent years. Yes, because most of the labs have LIS, HIS also, and all of the labs almost are automated, right? Next is each instruments. So this is the period where you will learn in depth about instrumentation. Okay, instrumentation is very must. So instrumentation means you should know about the working principle, components of any instrument, and application of each of these instruments. So under these three things, you must know each of the instrument that you have in your laboratory. And after you're done with all the instruments which are available in your laboratory, you must go about other instruments. You must learn about other instruments, yes, available. So like, the basic ones will be colorimetry, starting from the basic colorimetry, then spectrophotometer, immunoanalyzer, CLIA, ELISA, semi-auto analyzer, fully auto analyzer. There'll be different kinds, right, with different brands. And also your HPLC is very must, and it's also interesting. Okay, so even if you don't have a HPLC in your laboratory, you can you can attend workshops also. And electrophoresis, we have it in your PG practical, so it's a must. Then electrolyte analyzer, yes, ABG, PCR, molecular techniques, if it's available in your lab, it's very cool, right? So these are things that you need to know about instrumentation. So from where do you learn? You learn it from Teats. Compulsorily, you will learn it from Teats, okay? Next is methods of estimation of analyte. So you have different parameters that you analyze in your laboratory. So learn whatever parameters are available in your laboratory first, and then go for the rest. Yes, so what is the method of estimation of these analytes you will learn. And also, what are the basic methods of estimation, other methods of estimation of any analyte? That also you'll learn side by side in your lab postings itself, right? Next important one and most difficult one is going to be troubleshooting. So if we start reading this one by one, okay, if you start developing your skills on all these points, troubleshooting becomes easy for you. Yes, it opens gates to so many points. So you will think you will think in a wide basis. So troubleshooting is another important work. Yes, so these are the things that you will do in a second year of posting, or whenever you just enter your lab posting. These are the things that you must be concentrating on. Next is clinical posting. So all of you will be posted in other departments like your medicine, gastroenterology, nephrology, cardiology, diabetology. In all these departments, you will all be posted. So this is a screenshot that I took from the guidelines. So from general medicine, which will include endocrinology and even ICU, ICCU, and also pediatrics. So look at where all you play a role. Yes, endocrinology, it is actually our topic only, endocrinology. Okay, so we have endocrinology here. In this posting, so all the endocrinology profile is what you will be concentrating on. So whenever you attend these postings, what I would tell you is learn about diagnosis of all the diseases, okay, or whichever case that you're seeing in your ward, learn about the diagnosis of all that. Yes, that's when you can give your input on diagnosis and your input on interpretation of those tests. Yes, so this is actually we are very well deserving to take up DM endocrinology. It was possible few years back. and I'm greatly disappointed by how they removed it, because we learn in and out in and out of endocrinology, and endocrinology is purely based on lab tests only. Yes, diagnosis is purely based on lab tests only, nothing else. So we are actually very well deserving to take up DM endocrinology, but we don't have it, unfortunately. Yes. So ICU, ICCU, where do you play a role? ABG analysis. So ABG is itself means what? Emergency care. So you play a very good role in emergency care. So all your cardiac markers, markers of septicemia, inflammatory markers, yes, basics of ventilation, all these we have to be focusing on whenever you're posted in a ICU. Next is pediatrics. So we are dealing with newborn screening, inborn errors of metabolism, nutritional disorders, dietary advice. We are specialists in metabolic medicine and nutrition. Okay, these two topics are actually trending nowadays, right? And we clinical biochemists are the capable, eligible persons to be clinical nutritionist and specialist in metabolic medicine. Yes. So please take up the role. Yes. Next. So this is how you contribute to medicine, pediatrics, and emergency care. Right. Also, hematology, you can be posted, transfusion medicine, microbiology, and medical education unit. And they have also included nowadays, you will be posted for 3 months in a district residency program. Yes. So that is one more thing that you need to understand. So all these things will be done in your second year of residency. So this slide, just imagine, these are the different things that come under our branch. It covers almost the entire medicine. Yes, as you can see, I'm not exaggerating. Just look at it. These are the things that you will that you must be studying, or you must be doing, you must be practicing in your practice. Yes, in our practice as a clinical biochemist. So look at the major role that you're playing in patient care. Yes. So we need to understand this in first place, and we have to implement it in our workplace. That's what I would say. So let me just read these out. Yes. Liver function test, renal function test, pancreatic function test, GI function test. So all these function tests, organ function tests is our branch. Okay. So the interpretation is what makes you the interpretation is what is our role. So clinical interpretation and correlation is our role. Yes. So in today's world, no, everything has become all diagnosis needs these investigations, is it not? All diagnosis will need investigation. Nothing has been diagnosed, and no disease is diagnosed and treated without investigation, especially biochemical investigations. You can't treat anybody without this, right? So these are the organ function tests that we perform, and we need to be specialized in. Also, cardiac markers, lipid profile, diabetic profile, thyroid profile, ABG analysis, and enzyme analysis, bone markers, vitamin panel, anemia profile, even dialysis fluid. Yes, and inflammatory markers, newborn screening, inborn error of metabolism diagnosis, prenatal diagnosis. Just read this, and now you can't say this is a non-medical subject, is it not? It is clinical. It's a non-clinical. You can't say biochemistry is a non-clinical subject, is it not? It is a clinical branch where you're dealing with interpretation. All that I want you to understand is understand the importance of your branch and implement it in your workplace. That will change the perspective. Okay, only that will change the perspective. So, prenatal screening, endocrine profile, hormonal assays, autoimmune profile. You will be the one who will be giving the advice. Yes, you will be the one who will be giving the interpretation based on all these investigations. And autoimmune profile, serum protein electrophoresis, not just protein, lipoproteins, SDS page, HB electrophoresis, isoenzymes electrophoresis. Also, hemoglobinopathy screening, yes, from HPLC, and cancer profile, stone analysis, urine analysis, body fluid analysis like CSF, pleural fluid, pericardial fluid, ascitic fluid, and neurochemistry, markers of Alzheimer's, markers of Parkinson's, all the neurological diseases, multiple myeloma, multiple sclerosis, and toxicology panel and drug therapeutic monitoring. This also comes under comes under a clinical biochemist interpretation. Okay, so please do remember all these. So with, it is not, the list is not just ending. The one major part is molecular diagnostic that I've missed in the last slide. So this is actually very, very vast. Yes, so PCR, microarray, NGS, next generation sequencing, bioinformatics, cancer genomics, tandem mass spec, POCT finally I have added. So many, many more. So it's not, the list is not ending here. You have so much of things, investigations that are available. Yes, which are used in wide variety of labs and hospitals. Yes. So in all that, who plays a role? Who is eligible to interpret everything? We clinical biochemists are eligible to interpret all these things. It comes under RP. So please, please remember this. I'm stressing this point again and again. Yes. So this is about, these two slides are very, very important in our entire life. Okay. So that's, please remember it. So this is all about your second year of residency. Next is in your lab postings or in your college, whenever you find time, do case-based learning. Yes. So from where do you do case-based learning? Is from these textbooks, right? So these textbooks, especially all these have, TEAT's textbook of lab medicine also will have some cases in it. Also, this is a case-oriented approach which has been given in the NMC guidelines. So this is one book which I found it to be very useful in ABG interpretation. Okay, and this is the Marshall's textbook, which is good in metabolic medicine. This is Kaplan's textbook. Harrison's, if you find time and you would read this, any disorder or any disease, any topic you take and read it from these books, you will get a huge knowledge. Yes. Crook's textbook of metabolic medicine, clinical biochemistry, it has so much of flow charts. It's easy to learn textbook. Okay, it's also a very good textbook. And the first one is going to be the Bain's book. Okay, here also you will have multiple cases in it. So in each topic, there will be multiple case histories given. Yeah, so there is a case-based learning approach in all these books, so which you can follow. Next is, where do you refer all the books that I told you? Whenever you are presenting PG seminars, micro teaching, or any internal assessment, or any tests, or anybody, your professors are asking you to learn something and come the next day, assignments, anything for that matter, please refer textbooks. Okay, only then in your PG period, only you will be reading textbooks. So again and again, I'm stressing on reading textbook because it has a very huge impact. Okay. So these are the two books which you can refer for lab medicine, like Kaplan's and TEAT's. And these are the two books, Crook's and Marshall's, which you can refer for metabolic medicine and clinical chemistry. So what are the different skills that you need to develop? So not all colleges have all facilities. Okay, just relax. So you're not alone. Okay. So how do you then develop skills in all the instruments or all the equipments and all, anything else? For even in molecular diagnostics, any college will not have everything, is it not? So how do you develop? By attending conferences, workshops, hands-on training. That's how you will develop. Okay, this is a lifelong learning. Okay, whenever you want, you can attend workshops. So in your second year, if you attend workshops, it will be very useful. Right. So there are instrumentation workshops. For example, in Tamil Nadu, by PSG Medical College, instrumentation workshops are being conducted for PGs, which is very, 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 very useful. Okay. So you can attend it. I have attended it. So there is HPLC workshop. So even AMBI, year by year, they conduct few workshops on different instrumentation. So you can follow it. Yes, flow cytometry, there is an online workshop even. So you can just search it. And PCR, there will be PCR workshops, which will be conducted by Tamil Nadu Government Stanley Medical College. They conduct workshops, instrumentation workshops. on molecular techniques. Yes. So also there is training programs for ISO 15189, so that it if you attend, it is good. Okay, you will be understanding about the NABL assessment. So what are all the needs and requirements for any laboratory, clinical laboratory, so if or medical laboratory. So if you know this, it will be useful to you. So if any training programs come your way, just go for it. But you can do it in your second year only, not in your first year. First year you're a fresher, right? So second year, have these workshops for the second year. Okay, reserve these workshops the second year. Next, good lab practices training. So this is a course which has become mandatory, I guess, in few institutions. So there are so many courses available online also. You can go for it. Yes. So these are the different skills that you need to develop. There are much more, but a few basic things that I have listed out here. Okay, so yes, in your NMC guidelines they have given. So these are some things that we need to be understanding about. Yes, in the clinical laboratory as well as in molecular laboratory techniques, these are the different techniques that we need to develop ourselves in. Yes, so just to go through it. Next, again these things are something which you need to acquire knowledge out of attending workshops or any conferences, right? Of which, HPLC or another molecular techniques come here, as well as isolation, subcellular fractionation. Already we have seen this. But the thing is, there are so many things that you can concentrate on. So if you are searching for any workshops or, conferences or seminars, uh, have these points, have these topics in mind. So you search about it and attend those workshops. So also it has become, in the recent guidelines, NMC guidelines, they have said that the department should allow e-learning activities, which means that there are so many e-learning things available. Okay, online webinars, online conferences available out there. So you can, if you want to gain knowledge, have these topics in mind and search for them and attend those conferences or webinars, right? Next is PG exam practicals. Here and when you will start doing these practicals. So what all we will have? We will have case discussion in first place, any case, clinical case discussion, and a practical exercise on any molecular technique and practical exercise on any immunological technique. So this has been included in some universities. They are doing this. And standardization of analytes, like standardization of glucose, urea, creatinine, uric acid, even more protein. So even more. So you can actually perform standardization for much more analytes also. And estimation of analytes. So how you use a semi-auto analyzer, you must be knowing how you, what is an endpoint method, what is a kinetic method, what is the 2-point method. So all these you must know. And serum protein electrophoresis again, and chromatography, paper chromatography of carbohydrate, amino acids. It is a PG exam practical topic. So some universities, they do method validation also, exercise also as part of the practical, and even OSCE sessions, right? And the second day of practicals, you will have these three things. That is a thesis presentation on what you had done, what is your thesis topic, and what's the methodology findings that will be asked. And micro teaching on any short topic. This is to assess how you can teach your MBBS undergraduate students, right? And then grand viva, which means that it covers all the 4 papers, right? So one thing one extra book that I want to add is the for reagent and buffer preparation. You can refer to Varley's book of practical chemistry. Also, TEAC's third edition has, minute details on reagents, reagent preparation, buffer, and all these. This is an older edition, right? So you will have older ways of estimation of analytes. So these things you will find in TEAC's third edition, which can be available in your college library. Yes, I also have a copy of this, but I don't know how to convert it to a PDF. If I will do it, if possible, and upload it in the library. Yes, or if you want anything from that book, you can just text me. I will send. So this is about how your PG exam practical is going to be. So these are the practical techniques that you need to be aware of, or you need to be skilled in for your exam level, right? Next is research activity. So, what are the different research activities that you need to be doing in your PG period? That's thesis, dissertation that we had, that you know. Two oral presentations in national conference, especially in AMBI, if you present, will be good. Poster presentation. So many conferences are there which are which are asking you to PG for which has room for PG poster presentation and oral presentation, so you can go about it. Journal publication has become mandatory. Original, it can be original article. Even if you do a case report, that also will be good. Okay, so these things you can do. So whenever you find a rare case, just get the details, have it with you. So later on, you can write a case report and you can even publish it. Okay, so these are different research activities that you can do in your PG period. Right. So with this, we were completing how a second year PG should go about. So second year PG is actually gaining more knowledge. Yes, more knowledge as well as skills. So that's how your second year of residency is going to be going on. What do you do in third year of residency? So whatever thesis you had done, you had collected sample, you have analyzed it, you have done your statistics, results, write up. Write up is what you will reserve it for your third year. Yes. So in 6 months, you do it. Within 6 months of your third year, just do it. Finish off the write up. Okay. After that, start focusing on your studies, on your for your exams. Okay. Always aim for first. Okay. Always aim for medal. Right. So do what you will do is take out your syllabus, take a printout of it, previous year questions, take a printout of it, start assessing for each topic what are being the questions that have been asked in the past, have a knowledge of it, and start your exam preparation, right? So if you have the app in hand, you can of course do it, watch the videos as well as notes are available, so you can go about it, right? So I will also post already 2 months schedule and 3 months schedule have been shared, so you can uh, do you can follow that. So every day what you should do that I have given, and you can follow that. I will also share a 7 month schedule, so you have these 3 month 2 month 7 month schedule, so whichever you can use it accordingly, whichever you want. Yes, so that topic that day you can watch the video and notes from the app. Yes, so that's how you can learn parallelly and finish off that topic. So likewise, if you complete your 2 month or 3 month complete according to the schedule, you will cover up all the topics. Yes, and yes, you can keep revising what's the app videos, like recorded videos are available, notes are available. Live sessions will be happening every week. Yes, and revision sessions will be happening before the exams. Okay, so this is how your third year of residency is going to go. And last 2 point is about the app. Okay, I'm sorry for that, but still you have to be studying. That's what basically third year of residency is for, right? So with this, we are completing how we will be going through in our first year, second year, and third year. Are you all clear? Yes? Are you all clear? Is it helping you? Yes? Hope it does. So even if you are a second year PG or a third year PG, now you know what all should be done in the PG period. Okay, so that is again even more informative only. Yes. So, what is the scope of clinical biochemistry? I just have this one slide with me. Um, the broad general scope is going to be you can join any medical college, be get into teaching. Okay, you can be a research scientist. You can take up a career as a research scientist in any research laboratory, and you can become a lab consultant. Yes, where you will be dealing with interpretation and diagnostics, or even in a molecular diagnostics lab, where you will be advising people based on their molecular report. Yes, like based on their genomic report, you can advise them. So there are various labs that do cancer genomics. So based on their report, you advise them. So how to go about, how is their is it hereditary, and how to so all these advice interpretation of what are all the questions the people ask you, you will be answering. So likewise, there are so many laboratories here which are needing the guidance, which are needing the interpretation of the clinical biochemist. So you can opt for that. Yes, and metabolic medicine and nutrition consultant. So as I said, it's a very trending and viral topic that's going on nowadays. It's about the nutrition and what you take. Yes, and about metabolic medicine, like about glucose spike, insulin spike. So what are all the different foods that you need to take to control your insulin spike? So these things are actually trending. So I wanted to focus on all these, right? So this is how, so you will focus on all these, which means that this is our role. So please don't give up, right? Next is what you can do for your higher studies. If you want to do higher studies, you can take up NEET SS exam, where you can get DM clinical hematology and DM medical genetics. These are the two courses that are available for us. And INISS also we can take up, where you have a seat of for metabolic medicine and AIMS alone, just 1 or 2 seats, I guess. And you can take up FRC path. So there are various levels there. FRC path clinical biochemistry is available. So you can take up that. It's a costly exam, but still you can do it. Right. And you have various other fellowships for diabetology, genetics, nutrition. So you can take up those and you can set up your career that way. Yes. So these are the things that I would advise you to. Yes, these are things that I would suggest as scope of biochemistry. So there are so much in it. So in each of these, there are so much, right? Or you can get into the line of teaching individually. Yes, like how I am doing. So this is like, so basically in the first day of PG period, you may not have the idea of what you're going to become. Yes, I literally had no idea of what I will become. But after I did my PG, somehow I entered this line and somehow I survived. And I became, I now became passionate about it. But if you had asked me in my first year, I was very nervous. I can't even present one seminar. Okay. I usually have the, block of thought blocks. So, but now I'm able to tell my mind, talk my mind. So that's kind of difference. In the first year of PG, you will be different. After your PG, you will be different. So just wait for what your mind say to pursue. But in these 3 years, go according to what I said, right? Yes, scope of AI in clinical biochemistry is AI. We are in the AI world. Yes, maybe I did not include it, but I should have included. But as clinical laboratory consultant in this column, there is so much to do. Okay, a lab consultant is not just a small lab. Yes, you can actually make your own setup and start. Here, as a lab consultant, you can be pursuing pediatric biochemistry, neurochemistry, depending on which area you're focusing there, or even cancer genomics and tumor markers. There are various roles that you can specialize in. And AI in clinical biochemistry is the recent one that's coming up. Yes, machine learning and big data, it's the recent one that's coming up. So machine learning is something which will rule the world. Yes, so there is a lot of scope there, but in which line you should go, maybe I would do even more research and I would let you know. Yes, so there is scope definitely, but in the future, yes. So I guess I have told whatever I know, but there are a lot more. Biochemistry doesn't limit with whatever I had told you so far. There is a lot more to talk about. Maybe we will do it in subsequent sessions again. So I will collect all the ideas. I will collect all the new ideas, fresh ideas. Again, I will make another session. Yes. So hope this session had given you a good orientation of how you should thrive in your MD biochemistry residency. Yes. Thank you all for your patient listening.